and welcome into your health. You know, as you age, of course, gray hair comes in, skin starts to get a little bit wrinkly, and some things happen here too inside your mouth. But yet, you still have to communicate with people. You still want to have that winning smile. So let's take a look at what happens here as you start to age. And today I have with me a very special guest, Dr. Chet Swartzentruber.
Very good, John.
I got it all the way across.
That's
absolutely.
Right.
And between gals, you know, we could be a law firm.
That's right.
but you're my dentist, and very good job. I'm always very pleased every time that I'm in visiting with you. But one of the things we need to let our viewers know is what's happening in here as we start to age. And a lot of things you don't see, but they can have an effect on you.
They can, and a lot of things are going on. I brought some visuals today if we want to go through those.
Sure.
But one thing that happens a lot of times as people age, they begin to take medications.
Mm-hmm. And then, so you're going to wind up with a dry mouth situation.
Dry mouth, Jack. And the more medications we take, sometimes the drier our mouth may become. Mm-hmm. Different signs and symptoms. You know, your tongue might change in appearance. It might become dry and cracked. And sometimes food loses its taste and flavor. So that's something that's enjoyable to a lot of people, eating and enjoying food. So we want to look at that.
And you know, when I'm in for a examination or my regular checkups, you know, people think, well, the dentist is just going to fool around with your teeth, but you check the tongue.
Every time.
Absolutely.
While we're talking about tongues, that's the #1 site for oral cancer. And so we always check the tongue for different pathologies and lumps and bumps, like I like to call them. Just to make sure nothing, you know, is going on that shouldn't be.
Mm-hmm. So if you're winding up with a dry mouth, medications could be one thing. Also could be the fact that you're just not drinking enough liquids too.
That's right.
It can affect all your body, but especially in your mouth.
That's right. Drinking and staying hydrated is very important. There's a couple other things about dry mouth. You know, if you are a denture wearer, sometimes the dentures fit less well. With the dry conditions. Plus, and we see this a lot in two populations, in children who eat candy and in older folks who maybe take medications. The dry mouth causes cavities. And so cavities and decay would be this last photo here. And it's very, very important to watch that you don't get decay around existing restorations that you may already have. And that's another reason why going to the dentist is very important.
You know, one day I think, and I don't know if it was you looked at my mouth, you said, you got some old fillings in there. I said, well, that's because it's an old mouth.
That's right.
That's the thing we use. And of course, the big thing that can happen to you, obviously, as you age, you think about the fact that teeth are going to fall out. And then again, that's when people start looking at things like, well, do I need them all out? Do I need to just put in dentures, or what should I do? There are alternatives, are there not?
There are, and you know, some of the consequences of missing teeth are obvious. You lose the ability to chew. You might have a hole in that beautiful smile. But I want to talk to the ladies especially this morning, because if we lose a lot of teeth in our mouth, it can make us look older. And that's not necessarily, doesn't have to be the case. The teeth support the lips and the cheeks and gives our face a full and youthful appearance. If you look at the photo here, and if you think about measuring the distance from the tip of your nose to the tip of your chin, dentists call that vertical dimension. And when the teeth are missing, we lose that support and we kind of sink in. And so we can add teeth, and they don't have to be typical dentures like you might think.
You can do an individual tooth.
We can do individuals. We can even lock in.
Is that
permanently.
called an implant? Just to an extent, yeah.
Implants are one tool that we have at our disposal, and implants are simply just an anchor to support whatever we build on top of that. I was an engineer before dentistry.
I remember.
Yeah. And I love a complex challenge, and using implants to help solve a challenge in the mouth is enjoyable for me and rewarding.
That's a great way to do it. And then, of course, worn down teeth. Obviously, like everything else, you're going to wear them down after a while, aren't you?
Yes, sir.
Yep.
I've already mentioned that I was an engineer first. I like a complex challenge.
Yes.
there's more
Are there
going
some
on
there?
There's a lot here.
Yeah.
If you're a grinder or a clincher, or you chew rocks for fun, I don't know. I have different jokes, but I like talking to people about their challenges. If you have something like this and you want to address, just come see me.
So the biggest thing, Dr. Chet, is the fact that, as you're growing older, a lot of times it's not so much your teeth as it is your gums can give you a problem. And people don't think about that. I know my mother, God bless her, she had the most beautiful teeth in the world. All of a sudden she's having problems. She never paid attention to her gums.
Right.
But back in those days, it wasn't drilled into, no pun intended, it wasn't drilled into us to do it.
That's
yeah,
right.
That's great. Well, listen, I appreciate it. I'm going to get you to come back next week because we want to talk to our viewers about, at all stages of your life, how important it is to maintain a healthy mouth, because right here can have effect on all parts of your body.
That's right.
Okay? And just remember this, at least on a yearly basis, make sure you're visiting with your dentist. He can take care of things that can cause problems in the future. And we'll be right back right after this.